Diabetes per Charcha, a special program on fasting in Ramadan. Religious fasting is common, but it can be dangerous for diabetics. Over 50 million Muslims with diabetes worldwide are fasting during Ramadan. Let's see what our panel of experts have to say on this.
Today we have an elite panel of endocrinologists from Mumbai who will shed more light on this issue. The most important part of diabetes management is the medication which the patients take. And during Ramadan, I think it becomes even more important. So what are the changes the patients can do, should do actually, and before Ramadan, during Ramadan and after Ramadan?
So I think we've already discussed that these people are more prone to hypoglycemia during the fast and hyperglycemia during the iftar time, post breaking the fast. So you need to be a little careful. Obviously, most of these patients should undergo a pre-Ramadan counseling so as to review what are the complications present at that point of time before fasting, and subsequently how do they adjust the medications. Since they are prone to hypoglycemia, one should be very careful of what drugs they are going to take. So there are some people who are on oral drugs and some who are on injectables, whether it's insulin or GLP-1. Obviously, we need to know that these people are going to have meals after in the evening and throughout the night. So their medications need to be changed, majority of them. And from long-acting versions, if they are on oral tablets, then the long-acting medications need to be reduced, down titrated, and they are supposed to take the medicines, especially in the evening and not in the morning. And in the morning, during Sahari, they are supposed to take medications which are very short-acting, because they're going to eat for a very short duration of time and subsequently there's fast. So the medications need to be down titrated and you
have to stop, or we have to change. Is there something, oral medicines like that?
So see, metformin is a drug. So when you talk about oral drugs, you need to classify them whether they are short acting or long acting, and whether they increase the insulin production or not. If they are short acting and they do not increase the insulin production, like metformin, it's a very safe drug, can be taken. Only thing is the timing needs to be altered. But if you're on a drug like sulfonylurea, which is glimepiride or glyclazide, these are medications which are long acting and they work for more than 24 hours or so. So that you either need to down titrate depending upon the degree of control, or you need to switch over to meglenides group of drug, which is a drug which will act for about 2 to 4 hours only. So you can switch over to these kind of drugs from long acting drugs.
Plus you have the
DPP-4 probably. Yes, DPP-4 is something which is good. The potential for DPP-4 inhibitor like vildagliptin or sitagliptin is very less to cause a hypoglycemia. So these drugs you can probably prescribe more or take more during Ramzan. It's quite safe.
There have been good publications from Malaysia, from the Middle East on certain DPP-4 inhibitors.
Many people, I don't know, feel that pricking and the blood oozing out is probably a sin kind of a thing. Not at all. Yeah. You definitely need to keep monitoring your sugars.
I agree
that
with
is the most important thing.
My question is to Dr. Parmar. Dr. Girish, can I continue my exercise during fasting in Ramadan?
One should definitely. In Ramzan, the main fear is hypoglycemia and obviously hyperglycemia. But remember, hyperglycemia is for a month duration. Hypo is more that we are worried of, much more. Yeah. So with exercise, obviously your glucose levels are going to come down. So I would not advise one to do rigorous exercise. Definitely not. Light or moderate exercise, I would say can be done. But if you want to do it, probably it's after iftar. And in fact, as earlier pointed out also, one of the prayers itself is an exercise, a good kind of an exercise, which actually helps you in reducing your levels. So one can do, but it's evening post iftar, but not rigorous exercise.